A young adult is admitted to the emergency department. So we have a little bit description here about the patient. It is admitted to the emergency department after an automobile accident. The client is anxious and complains of severe pain in the right chest from contact with the steering wheel. The patient is complaining of pain. So the problem that we have on the stem of the question is pain. And how is the style of pain or the type of pain? Severe. We're dealing with an emergency here. It says the nurse observes shallow respiration. Why is this important? The stem of the question is telling you that the nurse is doing or did an assessment. So we have a scenario where the nurse observes for shallow respiration. So this means we have a respiratory problem. So what is the priority for me as the nurse in a respiratory problem? You see, now you have a clear picture of what is happening. It makes a lot more sense than before because we've taken the time to review the question. Professor, but it takes a long time to do this. Not really. Once you develop the technique, you do it very quickly. It's not going to take you as much time. I'm doing it slower here so it makes sense to you so you can learn. But you can do this very quickly. So we know that we're dealing with an emergency. We know that the nurse did an assessment. We know that the patient is in severe pain. And we have a respiratory problem. How do we know that this is a priority question? Keyword first. Reduce the client's anxiety. Important. Why is it important? The patient is anxious. Good answer. Maintain adequate oxygenation. Important answer. Why? The patient has respiratory problem. Shallow respiration. Answer number 3. Administer pain medication to decrease the chest pain. Important. Because why? The patient is in severe pain. And number 4. Maintain adequate circulating volume. Oh, okay. This one does not make a whole lot of sense to this scenario. There's no indication of bleeding. There's no hypotension with tachycardia like we saw in the post-percutaneous liver biopsy scenario. So maintaining adequate circulating volume, in my opinion, does not make much sense in this scenario. So I think we can eliminate it. So what is the first action here? When the 3 problems are accurate to the scenario. If you don't use a prioritization strategy, then you won't be able to know what's the correct answer. Reduce anxiety is psychosocial. Oxygenation is physiological. And you learned today that pain is psychosocial. So if we use Maslow's hierarchy of needs and we think about physiological needs has the priority over psychosocial needs, then we can eliminate answer number 1 and we can eliminate answer number 3. So the correct answer is answer number 2. Why is this the correct answer? For priority reasons, airway breathing has priority. But also, does it make sense to the stem of the question? Of course it makes sense. The patient has shallow respiration.